Now, the last question, from your cadaver studies, how exactly do these cutaneous nerves run out through the skin, and how exactly does this connect with the patient's brain and when applying manual therapy? Where is the intersection where DNM is born, and how does one apply it? Okay, well, it's pretty simple to apply. Just park your hand on top of the skin and let your hand stick to the skin, and you move your hand. And the skin will drag along with that. That's how you apply it. There's all kinds of other setups that you can do. Basically, what you want to do is you want to widen and shorten the neural tunnels. Okay, let me backtrack here for a second. You have 45 miles. I know I'm speaking to a bunch of Americans here, so I'm going to use miles. Okay, you have 45 miles of peripheral nerve in the body, and these nerves have their own vasculature. Let me show you a model that I made. Okay, can everybody see this? Okay, the green is the nerve, the blue is the vein, and the red is the artery. This is the neurovascular bundle. This is the 45 miles of this running through your body in various sizes, okay? Just like twigs on a branch on another bigger branch, and then branch attached to a trunk. And the trunk of the nervous system in the body is kind of the spinal cord, okay? The spinal cord would be the trunk, and then the skin would be really the outer leaf canopy of the tree, if you want to call it a tree. Anyway, so if you shorten and widen the neural tunnel, which is basically all the meat that surrounds the neurovascular system, if you shorten and widen that, if you shorten it, it will widen, and then the nerve and all the vessels and everything have more space to move inside the tunnel, inside the conduits through the body where they have to slide. And anything you do with your body, I put my hand in front of the camera. Okay, anything you do with your body, if you have your body flexed, the neurovascular tunnels will be shortened and widened. That's why it's good to curl people up on your treatment table, on their sides. Just curl them up. The nervous system, the peripheral nervous system is going to be more comfortable that way. It'll have the most room that way. Quadruped position. When we were evolving, way back when, we were quadrupeds. We were not yet primates, okay? We had 4 legs, and these legs were all kind of at this angle to our body. And so that's how the peripheral nervous system evolved. And when it's in pain, it's better to let it go back into that, a flexed position, flexed and curled, because that way it'll have the most space and it'll be able to feed itself the best. Here's another model. I'm not sure if I need to use this one or not. Basically, the model, this blue is the nerve, okay, and the little yellow things are neurons, okay, and the green stuff around that would be like the myelin, okay, if you can see that. And then there's this little red thing here, and this is just to basically depict how there's a mechanical arrangement here. So when you pull the nerve this way, there's a movement between the vessels and the nerve. Okay, vessels are right inside the nerve. So you can mechanically stimulate the circulation of a nerve, basically by just pulling the nerve a little bit longer than it would normally be inside of its little widened and shortened neural tunnel. I have a model that I built of the skin. Okay, so let's take a look at that. Here it is, right here. Okay, it's really big too. Actually, the skin organ is really thick. Most people don't appreciate how thick it is. But if we're looking at, okay, here's bone down here. Okay, so this white stuff is bone. This pink stuff is muscle, the muscle of the body. The mesodermal aspects of the body here. This white stuff is dense fascia. It's the containment system for our musculoskeletal system. That's so that we can be columns of water walking upright through life. Okay, without this containment system, we would be puddles of water on the floor, basically. So this allows us to be contained. It's a containment system right here. So here's the skin organ, this whole bubble wrap thing with the skin on top here. This is called hypodermis, okay? Hypodermis is a fat layer which basically allows for mobility of skin over top of fascia. And here we have a skin layer, and there's a sheet of clear plastic here, which is to represent dermis. And then this is epidermis. Epidermis comes from the same embryonic layer as does the brain, the spinal cord, and all the nerves. Okay? They can talk to each other. Epidermis and neurons can talk to each other. The neurons come up underneath the epidermis, they kind of plug into the bottom of it. And keratinocytes, which make up epidermis, they're living cells, at least the bottom layer is, and they secrete ATP when somebody touches you. Okay? And so the ATP stimulates the sensory neurons. That's how that works. But there's also mechanically sensitive neurons inside skin that will respond directly to any pressure. But these keratinocytes can talk to neurons. Okay, so we're going to remove the fat now from the fat layer. Is actually really quite thick, like on a person who is somewhat chubby, like myself. It can be about 4 inches thick. It's still skin organ, but it separates the surface of the body from the mesodermal musculoskeletal system of the body. And here we have a nerve coming through the muscles. Okay, it's giving off branches to the muscle as it's coming along, and then it comes out through. There's this thing called the aponeurotic ring. Okay, I don't know if you can see that very well. This green ring here. Basically, it's a hole in the fascia. It's like a grommet hole. The nerve comes up through there. By now, all the motor branches have peeled off and gone into muscle to run the muscles and to collect feedback from the muscles. Okay, and this cutaneous branch now, all it has to do is deal with the skin organ. But what's involved in running a skin organ is a whole ton of homeostatic mechanisms and autonomic mechanisms. The skin organ has 6 different levels of size of vasculature in it in order to keep us cool or keep us warm. These things can be run independently a little bit through different neuropeptides. It's very complex. However, when you think the skin organ contains 10 times more blood inside of itself than it needs for its own maintenance, okay, that means if you are in an emergency and there's suddenly a bear running after you, boom, all this blood is going to come from the skin organ, boom, into the muscles and pump them up. Your skin will get baggier because there will be less blood content in it, less volume content in it. So the skin organ will be a little bit baggier, but all this blood will have gone into the muscles and pump them up so that they're like way more efficient as levers to get you the heck out of there, away from the bear. Okay, that's the sympathetic nervous system in action. Okay. All right, but it's also sensitive to your emotional state. Okay, so if you're embarrassed or, angry, oh, this thing turns darker. Oh, dark red. Oh, if you're scared, you're going to blanch. Okay, there will be like a lightening of the color of your skin. You just go pale and maybe you'll turn a little green. Okay, so it's very responsive emotionally. This comes from having been primates for so long. Okay, so when we're primates, I mean, primates have all kinds of color variation depending on how excited they feel, I guess. I don't know. Anyway, so we still have that to a degree. Now, so the cutaneous nerve is coming out through this thing called the aponeurotic ring. And it contains sensory neurons and it contains autonomic motor neurons. That's all it has. It doesn't have any branches to any striate muscle anymore because that was over with a long time ago. The cutaneous nerves are mostly sensory and autonomic, and except in the face. Okay, in the face there is some muscle action happening within the skin organ. That's a little different critter. It comes from a different part of the ectoderm, neuroectoderm. So the muscles inside the face are very alive and active and responsive to emotional output. Like we're communicating through our face. And so inside the skin is muscle run by the facial nerve. Okay. And the trigeminal nerve, which is the sensory nerve, they're all mixed up together and they anastomose all over the place in the face. But in the rest of the body, it's like this. They're divided. Okay, so anyway, when you move the skin organ relative to the rest of the body, you're going to be moving nerve. Okay, and the nerve that you'll be moving will have mechanosensitive vasculature within it. You'll be able to manage the shortening and widening of the neural tunnel plus the lengthening and pulling through the neural tunnel of the nerve rami. And I hope that answers the question. How does one apply it? Well, one just moves the skin organ in some favorable direction. I think, this is what I think, and I'm going to just go to my grave announcing it, that right here is where the tender spot is. Okay? The tender spots that we feel on people and they feel us feeling. So you can definitely do search with your fingers and go, okay, is this where it hurts? Is this where it hurts? Is this where it hurts? That's where it hurts. Okay. That's the sore spot that you want to address. You want to address it in as kind a way as you possibly can. All right, so you kind of bunch all this stuff up so that it widens and shortens, and then you pull this cutaneous nerve through the grommet hole more. And as soon as you do that, you go poke, 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 and they go, are you still in the same spot? They'll always ask you that. Are you in the same spot as you were? Yes, I'm in exactly the same spot as I was before. Does it hurt anymore? No, it doesn't hurt anymore. Yay, then we're on the right track. And that's when the treatment actually starts. Okay? That's when you have to just sit there and wait for quite a while. Couple minutes at least, sometimes 5 minutes, sometimes 15 minutes. Okay, you just have to learn. This is where your practice of sitting and meditating and and kind of like zoning, staying connected but not moving. Okay, don't move anymore. You're in the right position. You got everything set up the way it needs to go. And just wait and let the brain of that person who had that pain, let their brain do all the heavy lifting. Because it will, because now it has a chance. And so it's going to take advantage of the opportunity to feel better and not have to be in pain anymore and not have to have sore spot.